So let's then talk about, we're going to spend the rest of our time today talking about trust agreements. Not that, the rest of these don't deserve attention as well, but that's why we're here. Now, this is a bit of an oversimplification, but I think for our purposes it is sufficient. You can think about trust agreements essentially in one of two categories. There are point-to-point agreements and there are multi-party agreements. Now, it's always a challenge to simplify the world, but I think that this one is fair as far as it goes, and that is when you're going to exchange data. There are only so many ways you can do that. Historically, we have had a point-to-point framework, and it certainly has worked well. It certainly supports a lot of data exchange around the country today. Many of you are parties to point-to-point agreements, multiple point-to-point agreements. Primary benefit of a point-to-point agreement is that it is 100% customizable. You have two parties, you know who each other are. While you may start with a form agreement that one gives to the other, there is a dialogue about that agreement, and at the end of the day, the parties agree on what the point-to-point agreement says. Now, I'm not saying that means that everybody gets what they want. Of course not. By definition, that's not going to happen. But with a finite set of parties who know each other, who develop the point-to-point agreement really on a one-off basis, it is customizable to the situation. So it fits the situation quite well because in most cases it is designed for that particular situation, even though it may start with a form document. Primary drawback, and this has become clear over the last few years to the point-to-point framework, is that it's really not scalable. It's not scalable on a large-scale basis. It works fine for some situations, but increasingly participants in the federal and the non-federal space have come to the conclusion that they're really not going to be able to get where they want to be in terms of data exchange using a point-to-point framework. That does not mean that point-to-point agreements have no value. It does not mean that we will not continue to have point-to-point agreements. Of course we will. What it does mean is that for widespread exchange, whether it's at the local, regional, super-regional, or even the national level, the point-to-point framework really doesn't scale to that type of environment. When you're talking about multiple parties across multiple organizations. So that's really why the second bucket of trust agreements exists, the multi-party framework. And that's been around for a while. That's certainly not, that's not a brand new concept. That's not anything that the NHIN trial implementation created out of thin air. The concept has been around for a while, and there are many operational HIEs across the country who are using multi-party agreements. So the primary benefit of a multi-party agreement is that it is infinitely scalable, and it can accommodate an infinite number of parties. The drawback is it is not as customizable as the point-to-point. Instead of two parties, you may have 200 or 300 or 2,000 parties to the agreement. And by definition, you do not have a fully tailored customizable agreement. There has to be consensus among the group. Now, again, we're not talking about what's good and bad, what's better or worse. That's really not the issue. The point is that these exist. They both have pros, they both have cons, and I think they will both continue to exist. When the NHIN Exchange, when we sat down to really create that a few years ago, and Lisa was certainly part of that, the concept, we knew very well that the concept was an exchange-based activity that would support multiple participants, a network of network model with multiple nodes, and it was apparent to everyone in the room, folks from the VA, the SSA, the DOD, CareSpark, Med Virginia, Kaiser, others who were involved from the very beginning, that a point-to-point construct was not feasible. Then the question was, well, okay, then what type of multi-party agreement should we have? What should it look like, and how can that be used to support the notion of a broad-based exchange within a network of networks model, potentially nationally? The end product, as you know, was a document that we affectionately refer to as the DURSA, Data Use Reciprocal Support Agreement. I did not name it, much like Melissa did not create her job title, but that is that is what it's called, and now most folks just call it the DURSA, and it stands for a lot of things. Not all of them good. When people hear the DURSA, not every thought that's conjured up is a happy one. What I want to try to do is demystify a little bit what this thing called the DURSA is, and in the context of that, crosswalk it to the trust framework that we covered earlier, and at least help talk about how the DURSA supports the concept of trust. So, one of the fictions is that if you, whoever you happen to be, if you want to exchange health information, you have to sign the DURSA. Well, that is not true. That is categorically not true. However, what is true is that if your organization wants to become a participant, capital P participant, in the NHIN Exchange activities, and you meet all of the other criteria for that, then yes, you will have to sign the DURSA in order to be admitted into the NHIN Exchange. However, as I said before, there are lots of exchange activities outside of the NHIN Exchange, and the DURSA does not apply to any of them. And so, no, you do not have to sign the DURSA in order to exchange information. Right, so what is this? What is this DURSA thing? And there are lots of answers to that question. The one that I want to focus on is it's a legal agreement. When you get down to it, and you clear away all the smoke, the DURSA is a contract. It is an agreement among multiple parties who wish to participate in the lawful and secure and appropriate exchange of information using a set of interoperable standards and specifications that have been and continue to be developed through what we call the NHIN. And as you know, the NHIN is a set of services, specifications, protocols, and procedures. The NHIN is not an it. There is not an NHIN box. There's not an NHIN Inc. There is no it to the NHIN. It's a set of specifications, policies, procedures, and protocols. And so when we talk about the NHIN Exchange, we are talking about a particular type of activity that is within the broader construct of the NHIN, this set of policies, services, procedures, and specifications. Now, unfortunately, we don't have the time to go into detail on every one of these bullet points. And again, there are other presentations that you can access through NEHC where I think we have done this. But what I want to leave you with is understanding that while the DURSA preceded the trust framework, and it certainly did because it was a trial implementation deliverable that has continued to go through revision. It is an organic document. Yes, it's a contract, and we tend to think of contracts as very stowed and stale and very legalistic and very rigid, and they go into binders and they collect dust and all that. Well, some contracts do that. Some are designed to do that. The DURSA is a contract, but it's not designed to collect dust. It's designed to be organic. It's designed to be a living document. And the testimony to that is that we have, even since it was originally signed by the initial participants in order to support their activities through the trial implementation, it has gone through revisions. Each of those revisions involves federal clearance. So it's not a simplistic process by any means. It's a very thoughtful process. But even as we speak, we will be doing another set of revisions. Why? Because the environment in which the DURSA exists, the NHIN Exchange, is itself a living, breathing, evolutionary framework. It continues to evolve. It continues to take on different dimensions. And so the DURSA is designed to scale with that. The goal, though, was to try to touch on each of these components of trust. And the fact that they were developed separately, it really is quite interesting how well they sync up. In terms of agreed upon business and legal requirements and expectations, what the DURSA says is that signatories to that agreement will comply with HIPAA and other applicable law. We have some participants who are federal agencies. They're subject to the Privacy Act of '74. They're subject to FISMA, Federal Information Security and Management Act. They're subject to rules and regulations that are the force and effect of law. We have others that are covered entities under HIPAA, so they're certainly subject to HIPAA. Others who are state, or some who will be participants who are state organizations, who are subject to state government legal requirements. And so we have participants who are subject to a variety of laws. What the DURSA says is you comply with HIPAA, and then you comply also with the other law that's applicable to you. Also, the DURSA talks about permitted purposes. In other words, when you participate in the NHIN Exchange, you are agreeing to do so for specific authorized reasons. It's not a free-for-all. It's not the Wild Wild West. It is a structured and monitored set of activities. Now that will grow over time, no question about it. But there are specific permitted purposes, and everyone signs on to those, and everyone knows that everyone has signed on to those, and that people will respect that, which means you won't get spammed and phished and all the other bad things by being a participant in the DURSA. That's important in terms of the code of conduct. It's important in terms of building trust. Let's skip over to the oversight. The DURSA does codify a governance framework. Now we are not, the DURSA does not govern the NHIN. First of all, the NHIN is not an it. It's a set of policies, procedures, specifications, protocols. And we all know that we are embarking upon a rulemaking process that is much anticipated that will speak to a variety of activities related to data exchange. However, the DURSA does codify an agreement among a set of participants, those who have signed it: VA, SSA, CMS, DOD, Med Virginia, Kaiser, Regan Streif, and others who have signed the agreement. And what the DURSA does is to create a committee that allows those signatories to sit down and talk about issues that apply to their activities. It's called a coordinating committee, and it is responsible really for implementing the exchange activities in conjunction with ONC, and really being an operational support committee. Because right now there needs to be one, as one of the trust components is oversight. We do have breach reporting requirements. We do have dispute resolution requirements. And those are important in terms of oversight and transparency, and also in terms of accountability. Ultimately, at the end of the day, any activity, participation in the NHIN Exchange is voluntary. No one's mandated to do this. They're doing it because they see a value proposition to it. And the different participants can articulate that value proposition. And here I'll put in a shameless plug. On June 28th, NEHC is going to be conducting another program that I urge you to participate in that is going to talk about the value proposition for the NHIN Exchange. And there you'll hear stories about, folks who have, why are they in the exchange today? Why are they there? Why have they made the investment? And there are lots of different reasons and lots of different stories. But the important point for today is folks are there because they want to be there. They want to be exchanging data through an organized exchange. That's true of all the exchanges that are in operation in the country today. Folks are there because they want to be. Well, that's a good thing, but also knowing that we must have accountability and enforcement. At the end of the day, because folks see value in their activity, because folks see value in their participation, they do not want to lose that value. And therefore, that's the only framework in which discipline becomes relevant. And so the DURSA talks about, certainly talks about dispute resolution. It sets a framework for compliant behavior. But in the event, and no doubt it will happen at some point in the future, in the event that someone is non-compliant and does not follow the corrective action regimen that is established, then the DURSA does allow for suspension and termination of participation in the exchange. I'd like to think it will never be used, but of course it will be at some point in the future. Another part of accountability and enforcement is the whole issue of how do you allocate risk in a complex multi-party realm. The DURSA addresses that through a fairly complex risk allocation methodology that attempts to allocate the risk with the ability to control that risk. And that's really all the detail that I can get into. There may be some questions around that. We can talk about that during the Q&A.